Hi guys, so this evening we will talk about the skin and some lessons on the body membranes. So our body membranes, they function to cover body surfaces, to line body cavities, and to form protective sheets around organs. It is classified according to tissue type. So it is important that you can remember our lesson in tissues because you will apply it now on this lesson. There are two major categories of your body membranes. You have epithelial membranes and you have connective tissue membranes. So for epithelial membranes, you have cutaneous, mucous, it's serous membranes. And connective tissue membranes, you have synovial membranes, to which we will get to later. Epithelial membranes are just covers simple organs, okay? And they are simple organs. They are also called your lining membranes. Remember the function of your epithelial tissue? The epithelial tissue serves to line organs. Okay, so this is where we apply now the information with regards to epithelial tissues. Now they actually line membranes. So these membranes can contain both an epithelial tissue layer uh, and or a connective tissue layer. Now, your cutaneous membrane is your skin. Your skin is a dry membrane. It is our body's outermost protective boundary, and it has two major layers. Okay, it just has two layers. Your epidermis, which is composed of your keratinized stratified squamous epithelium. So going back to our lesson about types of epithelial tissues, when we say stratified squamous, that means this is an epithelial tissue that is composed of squamous cells or squamous tissue that's stacked in layers. Keratinized meaning this has keratin in it. It's a little bit harder than your just regular squamous epithelium because it's supposed to cover, remember? And the lower layer of your skin or the deeper layer of your skin is your dermis. This is composed of mostly dense or fibrous connective tissue because it's supposed to be, when you say dense, it has to be a little bit more filled in or compacted to be able to perform its function to support. Now, so this is your cutaneous membrane. Obviously, your skin, we all have that. You know that. Okay, see. Now, moving on to your mucous membranes. Mucus, okay? Not to mistake for your mucus, which is, your sipon or your snot. These are moist membranes. So, the mucosae, this is the singular form of your mucosa, secrete, sorry, this is the plural, this is your mucosae secrete protective lubricating mucus, okay, lubrication mucus. They line all your body cavities that open to the exterior body surface. So what's one example of your mucous membrane? Your oral cavity, diba? It has been adapted for absorption or secretion, and it has two layers. The epithelial type would depend where it is on your body, and it has a loose connective tissue compared to your skin. Your skin has dense connective tissue. Your mucous membranes have loose connective tissue, which we call the lamina propria. Okay, so okay, so this is your mucosa or your mucous membrane. The connective tissue that's on it is your lamina propria, which is the deeper part, and then the epithelium that lines it. Okay, so this is hollow. This is the cavity. For example, in your esophagus. So kung cut section mo yung esophagus, this is the space or this is where the food comes through. The epithelium that lines it. Deeper to it is the lamina propria or its loose connective tissue. And amo na, imo epithelium, this generally your mucosa, most of it is your mucosa combined. Now, let's go to your serous membranes or your serosae. They line compartments in the ventral body cavity that are close to the exterior of the body. They occur in pairs and separated by serous fluid with a visceral and parietal layer. Where did you hear the words visceral and parietal? We talked about this in the language of anatomy, remember? Okay, so wala ni siya application of the words we previously learned in our first lesson. So your serous membranes have two layers. Your simple squamous epithelium and your areolar connective tissue. So these are your serous membranes. Remember, for example, in your pericardial cavity, diba? So this is your serous membrane, no? So I'm gonna show it. It has a serous fluid in the middle. This is the visceral layer because it's in the viscera, meaning it's right there on the organ. The parietal layer is its outermost layer. So this is your serous membrane, right? Okay. So now, a fist thrust into a lymph balloon demonstrates the relationship between the parietal and visceral serous membrane layers. So this is an analogy, no? Your outer balloon wall, if you put your fist inside a balloon, the outermost part of the balloon wall would be analogous to your parietal serosa. The air in the balloon is comparable to your serous cavity, and the inner balloon wall is comparable to your visceral serosa. And obviously, the hand inside is the organ or the viscera. Okay, so this is the closest analogy that the author can think of. Okay, so here are specific examples of your serous membranes. You have the peritoneum. This is a serous membrane that covers the organs of the abdominal cavity. Remember from the first lesson, your pleura or your pleurae in your lungs. Pleura, lungs, pericardia, heart. Next, move on now to your connective tissue membranes. The synovial membranes. What are these? This is composed of loose areolar connective tissue only. It has no epithelial tissue. So this is what is different with connective tissue membranes, is that wala ni siya yung epithelial tissue layer. It's just connective tissue, okay? Your synovial membranes line your fibrous capsules surrounding your joints, in your knees, in your elbows, okay? It lines the bursae in your joints and tendon sheets in your joints. Your cerebral membranes also secrete a fluid which serves as lubrication to cushion organs moving against each other during muscle activity. If you remember advertisements from way back, ABS-CBN is still around, or if you're not kapamilya, maybe you're kapuso, there used to be ads. I hope you're still alive around those times. You know those medications for arthritis. Tapos may ara sila animation of the knee, or in your knee and your part of your and then your leg bone, and it's like grinding against each other because there's no more lubricating fluid in it to cushion the knee, your synovial membrane. So doon mo na siyang analogy da. So amo ni siya, no, in that advertisement I was talking about. If this is your knee, okay, or this is not actually your knee. It's more like just a regular synovial joint. This is not your knee, huh? Okay, so a typical synovial joint. So, amo ni siya, no? This is the cavity of your joint. Joint. Some people call this a joint. Okay, so this is your joint cavity. This is the ligament. What did I say ganito before? Ligament is joints, bone to bone, diba? Okay. So, if this is your ligament, this is your joint cavity, no? This is where the synovial fluid is. This is where the lubrication goes. Okay? And this here is the articulating cartilages, which is composed of hyaline. Okay? Hyaline cartilage. Okay? Now, we move on now to your integumentary system. It consists of your skin, or your cutaneous membrane, and your appendages. The skin appendages are your sweat glands, your oil glands, hair, and nails. Now, what is the function of your skin? It insulates and cushions deeper body organs, obviously, and mostly serves as protection from mechanical damage, such as bumping, cutting yourselves, chemical damage, acids and bases, from heat or cold, UV, bacteria, and most of all, water loss. Okay, the skin also regulates heat loss with the assistance, of course, of the nervous system. Your skin also acts as a mini excretory system with help of your sweat glands, because sweat aids in the loss of urea, salts, water. It also synthesizes vitamin D. We'll further discuss it later, and also secretes the secretions in on your skin creates a protective acid mantle. So I want you to read on this table, okay, the functions of your skin and how it works. Okay, it's basically just a more thorough explanation of the words I just said in the earlier slide. Okay, you read on this, guys. Next, the structure of the skin. So as we said earlier, there are two kinds of tissue which compose the skin, no? The epidermis and the dermis. Now, on the deeper part of your skin lies your hypodermis, or your subcutaneous tissue, or the fat. Mataba, taba. Okay? Your subcutaneous tissue, or your hypodermis, it anchors the skin to underlying organs. It's technically not a part of the integumentary system because it's composed mostly of adipose tissue, fat. Your subcutaneous tissue serves as a shock absorber and insulates deeper tissue. Okay, so this is important. Remember the skin structure. You see this so many times when you see advertisements for skincare products. Anyway, this is your epidermis, okay, and deeper to it, your dermis. Your dermis has the papillary layer and the reticular layer. We'll discuss later what's the difference between these things. This is your hypodermis, or your subcutaneous tissue. As you can see there, that's adipose. Okay. Now, you have several other structures here that you can find in your dermis. Mind you, in your epidermis, there's layers there. Okay. That's your pore. So famous nowadays because of the whole trend in skincare. Now, we will discover the appendages of your skin. You have your eccrine sweat gland, your erector pili muscle. The eccrine sweat gland is just your regular sweat gland, really. Your erector pili muscle is responsible for your chicken skin or your goose flesh when you're anxious or you're scared, or when you see your crush and you feel like the hairs at the back of your neck are standing up. That's because of your erector pili muscle. Your oil glands are there, of course. This is your hair follicle, and the hair root is inside the follicle. Okay. Along with that is you have nervous structures there, of course. This is your nerve fibers, the corpuscle. We'll discuss what corpuscles are in future lessons. And your this is a collection of nerves. It's called the plexus. So when you say here root hair plexus, this is the collection of nerves that's responsible for receptors in your hair follicle. So it's called a root hair plexus. Okay? And these are your blood vessels, right? This is your buhok. Now, the epidermis again is the outermost layer of the skin. It has keratinized stratified squamous epithelium. Okay? So most cells are keratinocytes. They produce a fibrous protein called keratin. So amo na siya nga keratinized stratified squamous epithelium, because keratinization makes the epidermis tough to protect us from the elements, and desmosomes connect the keratinocytes together. The cell that makes keratin are called keratinocytes. The process is keratinization. The organelles that connect keratinocytes together are called desmosomes. Okay? Your skin is avascular and has 5 layers, as I mentioned earlier. Now, I want you to memorize this. Think of a mnemonic to memorize this. I don't have a mnemonic for you. Just make something up. The weirder it is, the better, so you can memorize it. Okay. Um, so this is the deepest ha, pinakadalum, is basale, spinosum, granulosum, lucidum, but it's not present in all parts. Usually you can see this in your palms and your soles of your feet, huh? And corneum. But in general, if you are to enumerate the layers of your skin, 5 dapat ha, regardless if it's the palm or not, lucidum should be there. Unless specified, obviously. Okay, so your stratum basale is also called the stratum germinativum. Stephanie Germanota, Lady Gaga, stratum germinativum. I just made it up. No, that's really true. For I was trying to make a mnemonic there and I failed miserably. Okay, so again, this is the deepest layer of your epidermis. It lies next to your dermis, and it has a wavy borderline with the dermis that anchors the two together. Okay, this is where the cells undergo mitosis, and the daughter cells are pushed upward to become the more superficial layer. So they're sila multiply, and then with the moment it matures, it goes up, upward, and upward. Okay. Next is your stratum spinosum. This is when the cells become increasingly flatter and more. What did I say here? Kung ano maging siya. I can't see that because my camera's right there. That's my face. I don't know what the word there is, but amo na siya. Basta the cells they become flatter. I'm so sorry. Okay. Stratum granulosum. Maybe I should go back to that. Okay, moving on. I don't know how to edit that. So, sorry guys, just bear with me. Okay. So, I'm gonna turn off. So sorry. Um, and then your stratum granulosum. It's just a regular layer it's a higher, it's more superficial than your stratum spinosum. Okay. Your stratum lucidum is formed from dead cells of the deeper strata. It occurs only in thick, hairless skin, palms, hands, soles, feet. Lucidum, palms and soles because it's lucid, it's maputi. No discriminatory. I'm not discriminating by implied means. Okay, basta because it's lucid, maputi, palms, lucido. Okay. Sige. And corneum is the outermost layer because it's corny. It has keratin because it's corny, so corneum. Okay. So if you think about it, your stratum corneum is just filled with dead cells. This is dead skin, and these are just dead cells, and we take care of it so much, right? Jeez. Okay, so I'm gonna show ha. This is your stratum corneum, granulosum. Okay. So it's granulosum because it's granules, but basically they're just flat cells. Okay. They're starting to die here until they're like dead here. The cells are dead here. Okay. In your corneum. Tapos sa muna, granulosum. Then you can find your keratinocytes here between your granulosum and your spinosum. Okay, they're pre-keratin. That means it's before your pre-keratin is found on your stratum spinosum. Your pre-keratin is like the baby form of your keratin. Before it matures to become the keratin, it has the pre-keratin form. It's like parang baby pa. Okay. This is a dendritic cell. This is an immune cell. Okay. So as we said earlier, these are your keratinocytes and your desmosomes. Connect them together. This is your stratum basale. Okay, so this is where the cells are actively dividing. Okay, and then they go up, higher, up. Okay, and then there's your melanocytes, responsible for the color of our skin, and then the dermis goes down there. Okay, so your melanin, as we said, is the pigment produced by your melanocytes. The melanocytes are the cells that produce melanin. They are in the stratum basale, and the color is yellow to brown to black. And this is responsible for the color of your skin. Okay, your dendritic cells, epidermal dendritic cells. If we have a quiz on this particular structure, it has to be in complete. Dapat nga name ha, epidermal dendritic cell, because you have dendritic cells everywhere else. this one is specific to be in the epidermis. So it's the epidermal cells. Okay, these are the immune cells in your epidermis. That's just it. And then your Merkel cells, these are your touch receptors. So when you're touched, oh, na-touch ako. Yes, my Merkel discs are working. My Merkel cells are working because I'm touched. So these are associated with your sensory nerve endings. Now, moving on to your dermis. This is where you can find the connective tissue layer. It's below the epidermis, and as I said earlier, it has two regions, papillary and reticular. Diba? Okay. So your papillary layer is the upper dermal region, which contain projections called dermal papillae. Okay. The connective tissue here you can find is your areolar connective tissue. It indents the epidermis above and has many projections that have capillary loops, and some house your pain and touch receptors. On your palm and your sole surfaces, the papillae increase friction and gripping ability. So it adds to your key ball. And your fingerprints are due to your papillary layer in your skin. Okay. Next layer is your reticular layer, which is the deepest skin layer. Okay, it is composed of dense, irregular connective tissue. This is where you can find your blood vessels, your sweat and oil glands, and your deep pressure receptors for your lamellar corpuscles. Okay, so if you look at this on a microscope, and if you stain this is how it's going to look like. On a 100 times magnification on your microscope, this will be your epidermis. This is your dermis, the entire thing. So this is where your papillary layer is. You can tell because of the connective tissue there, and there's not much organelles there going on. And the moment you look a little further down, you can see that there's so many things going on in there. It's a reticular layer. These little O's here, that's your blood vessels. Okay, remember you can find your blood vessels in the reticular layer, and several other organelles there that, in all honesty, I don't know what they are. But we'll just refer back to the slides, the previous slides. Okay, so what are your other dermal features? You can find your cutaneous sensory receptors, your phagocytes. Remember your phagocytes. You can also find your collagen and elastic fibers. As I said, your blood vessels, your nerves. Okay? Now, so there are three pigments actually that contribute to skin color. It's not just melanin, but it's mostly melanin. Okay. In natural, not natural, normal human being, we are a little bit yellowish, reddish brown. Kita as Asians, ha? Black pigments for our darker skin friends, no? Reddish brown, yellow mostly for Asians, pero not the jaundice type of yellow. There's jaundice and then there's yellow. Okay, don't get them confused. Okay, that's because of melanin, as I said earlier. Now, sometimes when you eat orange vegetables, is carrot a vegetable or a fruit? Basta, when you eat carrots sometimes, some people would have a tendency to turn orange or orange yellow. It's because of carotene found in carrots. Sometimes stain siya in your own skin, and you start to share the color of carrots. So sometimes your urine turns orange because of carotene. Am I saying that right? I think I'm correct. Okay, so carotene also found in vegetables is responsible why some people have orange yellow pigments if they eat carrots, obviously, or any vegetable or fruit with carotene in it. Next is hemoglobin. Hemoglobin is the red coloring in your red blood cells because it's red blood. It's because of your hemoglobin. Now, this is where the words anemia comes in. Anemic ka? Ay, anemic ka kay kaluspa. One aspect of anemia is decreased hemoglobin levels. There's like a multitude of definitions for anemia. Actually, there's just three. No, actually, there's more than three. But in general, the most layman term for anemia is when you have low hemoglobin levels, tapos ka palang low ka. Okay, so it's not low blood pressure, ha? That's a misnomer. Ay, nabuhay mo BP, anemic ka. It's not that. That's a misnomer. Low hemoglobin is just one aspect of anemia, but it's the most common one. Okay? So, the oxygen content in your red blood cell determines the extent of redness. Okay? So, hemoglobin, hemo, blood. Globin is a protein. Okay? So, pag hemo, blood na siya. Alright? Yeah. Now, there are several skin colors that can be seen on the skin. So there's redness or erythema. Redness is just erythema is just the medical term for redness. Okay. Sometimes blush ka, no? Ay, mistisa. Erythematous. Joke. Hindi. Blushing din siya. No? What about the embarrassment? Or an inflammation, or kung of BP, some people go red. If you're febrile, or if you have fever, sometimes you go a little bit redder than usual, or if you're having an allergic reaction. Okay, now move on to pallor or blanching. Actually, pallor and blanching actually are they're not mutually exclusive. Okay, when you say pallor in general, that's luspad, like when you're like lapsi, like when you're like super pale. Blanching is when you press on your skin and then you see you press on it tapos gaputi siya. Okay. I feel like I'm a vlogger now. Basta when you press on it, when you press on your skin, nagaputi siya. That's blanching. Alright? Lain man ang blanching, magluto ka ha, lain na siya ya. Kung naglalanta ka mo mga master chef or mga top chef, lain na siya yung blanching ha, lain man ang blanching sa anatomy. Okay, so nga manglapsit ka because of emotional stress. Sometimes when you're very fearful or nadakpan ka, nagbinutig ka, nagapalang lapsit ka, pallor. Mamantahab ako kagina, no, anemia contributes to pallor. Sometimes magnubuin mo BP, palang lapsita, or if there's an impaired blood flow to an area, sometimes there's pallor if it's not very bad yet. Okay, ha? Next. Jaundice. This is what I was saying earlier. There's yellow and then there's jaundice. Jaundice in Hiligaynon is dalag. Gapalang dalag. Ang color mo do pareho sa crap, ang ginalakot bala sa curry. Ano siya? So, jaundice, usually, yellow cast na siya on your skin. You can also see it in the eyeballs, in the palms, on the floor of your tongue. Pasahon mo dila ang mga patient. You can see nga doon medyo yellowish na down there. Jaundice. Okay? It usually indicates that there's a problem with the liver. Okay? And also, bruises. Black and blue marks which can be hematomas. Alright? Sige, now, moving on to the appendages of the skin. Your cutaneous glands, or the glands that can be found in your skin, they're all exocrine glands. Remember that, ipa-compare ko sa inyo ang exocrine kag endocrine glands. Diba? Okay, so now, the glands on your skin are all exocrine glands. So you have your sebaceous glands and your sweat glands, okay? Okay, other appendages of the skin we talked earlier. Talked about it earlier, gali. Your hair follicles, and your nails. Sugar bear hair vitamins. I'm not promoting that. Random stuff. So, no, amo to kagina, no? On your skin structure, this is what you find. Reviewin niyo na lang na, guys. Okay. We'll talk about your sebaceous or your oil glands. Your sebaceous glands can be found all over your skin except for your palms and your soles. Okay, obviously they produce sebum, oil. This is everyone's number one enemy. Like, why are you so oily? Like, you should use like this particular toner para mag-stop ang oils in the face and all that. Para di ka mag-oily. But actually, oils in our body are not that bad because the sebum makes our skin soft and moist. It also prevents the hair from being brittle and kills bacteria, actually. Okay. So, Your sebaceous glands mostly have ducts that empty into the hair follicles and others open directly to the skin surface. And glands are activated at puberty with increased androgens or your hormones. And when you notice, when you went through puberty, you became a little bit oilier than usual, and then the acne started coming out because it's activated by your hormones. So, amo na siya, no? That thing on the side is your sebaceous gland, right? So, if you look at the microscope, no? So, this is the duct to your sweat gland. That's the dermal connective tissue layer. It's the hair in your follicle. And these are the secretory cells in your sebaceous gland. Now, your sweat glands naman, or your sudoriferous glands, obviously produces sweat, and sweat glands gani, and it's widely distributed in the skin. And it has two types, your eccrine and your apocrine, or eccrine or apocrine, depends on how you pronounce it. Your eccrine glands, they are more numerous and located all over the body. They have ducts too. It opens to your sweat pores. Okay. It produces acidic sweat, so water, salts, vitamin C, some metabolic waste, and its function is for body temperature regulation. So if you look at it in a microscope again, this is the, sorry, my nose is so itchy, I'm having allergic rhinitis. So um, that blue thing, that's the dye, it's not how your skin normally looks like. This is the dye na impose on your skills because the cells have been treated and dyed. Okay. Para ma-identify mo ang parts. So, amo ni siya ha. This is your dermal connective tissue. That's the things in between your ducts. Okay. So this is generally your sweat gland. These are the secretory cells in your sweat gland, and this is the duct. Okay. So, amo ni siya. Right. Okay. Now, apocrine glands. Usually found in your armpit and your genitals, and they start to function when you enter puberty. So the sweat here has fatty acids and proteins. This doesn't really play a role it plays a minimal role in body temperature. Okay, so next is your hair. There's hair everywhere except for your palms, your soles, your nipples, your lips. You know where your hairs are. Produced by your hair follicle. It's enclosed in the root of the hair is enclosed in the follicle, and the shaft projects on the surface. Now, your hair is made of hard keratinized epithelial cells. The melanocytes provide the pigment, and the hair goes in the matrix of the hair bulb in your basal layer. Alright, so muna siya ha. That's your hair shaft. That's the muscle I told you earlier that's responsible for giving you goosebumps. Sorry. Hair follicle, that's your hair root. That's the hair bulb. Okay, review that, guys. Okay, so that's the anatomy of your hair. You have your central medulla, the cortex that surrounds the medulla. There's the cuticle, which is the most heavily keratinized region of the hair. And as we've said earlier, the melanin provides the color. Now, so muna siya, no? It's not only the hair that has the medulla in its layers and the cortex. Basically, several other parts of your body has this structure. So be familiar. When you say a medulla, it's usually the deepest part or the deepest layer of a particular organ. So in this case, amo ni siya, no, that's this yellow color. Tapos outside of it is its cortex. And then the outermost layers, the most keratinized layer on a hair root is the cuticle. So if you look at it on a scanning electron micrograph or in your shampoo commercial, this is how you're going to see your hair shaft. Okay, I think we're all familiar with that. We've seen so many shampoo commercials. Now, what are your other associated hair structures? You have your hair follicles, we've said earlier. Now, the hair follicle is composed of an inner epithelial root sheath and an outer fibrous sheath. So the dermal region provides blood supply to the hair bulb because remember the dermis has the blood supply. So because the hair bulb is in there, did I show you about supply? And then the erector pili muscle connects to the hair follicle to pull hairs upright when you are cold or frightened. Now, this is the structure of your hair root, right? Okay. So for context, this entire thing is your hair follicle. This is the hair root, okay? So, amo ni siya ginahambal tayo the cuticle, the cortex, and the medulla. Now, this is your epithelial root sheath. Okay. And then your hair matrix, or this is where the baby hair cells come out. So it gets older and more mature, it grows upward. Okay. So the melanocytes responsible for the color of your hair, and then your hair papilla. This is where your blood vessels are. This is the adipose layer. This again, the blue layer here is the connective tissue. In this case, the fiber sheath or the dermal connective tissue. Okay. This is so itchy, guys. I'm so sorry. Okay. So let's move on to your nails now. This is heavily keratinized, scale-like modifications in the epidermis, your claws. This is your stratum basalum that extends beneath the nail bed, which is responsible for the growth, and it doesn't have pigment. That's why their nails are colorless unless gel extensions. Now, the parts of the nail, you have your free edge. Okay, my nails are short. Your free edge is basically, that's the thing that you cut with your nail cutter. The body is the visible attached portion. Your nail folds are the skin folds that overlap the edges of the nail, and the cuticle is the proximal edge. The root of the nail is in the skin, it's embedded in the skin, and then the growth of the nail occurs from the nail matrix of the nail bed. So, guys, do not cut your cuticle. You push it, but you don't cut it because it's part of your normal nail. Don't destroy it, guys. You get prone to infection when you get rid of your cuticle. Okay? So that's the free edge of the nail, it's the body of the nail. Your nail bed is underneath. Look, you see that's the bone. That's the cuticle. The half moon thing there is called your lunule. Okay, this is your lateral nail fold, the ones on the sides that sometimes our manicuristas cut. I don't understand why it shouldn't be cut. Just leave it there. Okay, now the root of the nail is embedded in the skin, as we said, and then the nail matrix is where the new nail comes out. Okay, so when there are some imbalances in the skin, pathology occurs or disease. In this case, infections and allergies. Now, there's this thing that we call the athlete's foot, and I think you're very familiar with this. We call this the tinea pedis, okay, because it's the fungal infection is called tinea pedis. This is not the fungi organism, this is what the fungal infection is called. Tinea pedis. Pedis because it's your foot. If it's somewhere else, for example, if it's on other parts on your trunk there, that's corporis. If it's in your hita, it's cruris because it's crural. Remember? Nah, muna siya. What's athlete's foot is the itchy or red peeling skin between the toes. It's very makate. Okay. Other infections are your boils, you have your furuncles, and your carbuncles. These are caused by inflammation of the hair follicles, and carbuncles are clusters of boils caused by bacteria. So, baby pa siya, sorry, if it's just baby, tapos, or sometimes solo lang siya, it's a boil or furuncle. If it's like a group of boils, if it's like a little bit more inflamed than usual because of a carbuncle. Sores or fever blisters, cold sores, usually caused by HHV or the herpes virus 1. Sometimes can be found around your mouth. Sorry, my nose is really itchy, guys. So the blisters can cause itchiness and a feeling of sting. There's also contact dermatitis. This is due to exposure to chemicals that provoke allergic responses, causes itching, redness, and swelling of the skin. Next, your impetigo is also caused by bacterial infection. It has pink fluid-filled raised lesions around the mouth and the nose. Psoriasis is usually autoimmune. That means it's your own immune cells attacking your own cells. And when you have psoriasis, this gets triggered by trauma or infection or stress or any changes in your hormones. So the keyword for psoriasis is scaly skin, silvery scales. Okay, red epidermal lesions covered with dry silvery scales that are itchy. Sometimes they burn. They feel like you're burning or crack. Sometimes they do. Okay, so this is for your HHV. As I said, usually around your, it's called caused by a virus. This is your impetigo. Okay, still bacterial in nature, easily treatable. This is psoriasis, no? Silvery scales. Okay, all the imbalances includes your burns. So caused by, this is due to tissue damage and cell death that are caused by heat, electricity, radiation, chemicals. This is associated with denaturation of protein. When you say denaturation of protein, it's when your your protein starts to let go of its actual shape. Because remember, your proteins have their own hiyang shape, okay, because of the way they're folded. Now, when they're denatured, they lose that folding, okay, which means that they can no longer function, whatever their function is, okay, and sometimes cell death. So, burns cause dehydration and electrolyte imbalance, which can lead to circulatory shock and then eventually death. Okay, so this is due to your this will, as I said, dehydration. You will lose a lot of body fluids, and you will have infection because you become an open ano ni, not an agar, more like you become food to bacteria because you lost your skin. So you become food for them. So bacteria starts to invade you, invades you. Okay. So here's a little tip. Um, we measure burns by surface area, like the amount of surface area that's been affected by the burn. So usually we use the rule of nines. I'm not sure. I think this is a little bit advanced for you. But I'd like you to know that there is such a thing called rule of nines when we measure the extent of a burn in the human body. This is only applicable to adults, huh? It's different with children and infants, okay? So, in general, each area represents about 9% of total body surface area. Some parts are just 1%. Let's not get too deep into that. If you do pursue medicine, you will know more about the rule of nines and you will be masubudan ka lang. Okay, so this is just the gist of the rule of nines, but I'd like you to know, at least be familiar with it. You know, just not something nice to know. So, para may applicability man niya, para may application ka man in real life with regards to burns. Okay, so these are your types of burns. You have your first degree burn or your superficial burn, your second degree burn or your superficial partial thickness burn. Now, with your first degree burn and your second degree burn, these are very painful. Okay, sakit hapdi ni siya yan. Especially your second degree burn is very mahapdi. With your first degree burn is usually your sunburn. Okay, your skin is red and swollen. Or if you're morena like me, gaitong ka lang, you don't burn. Just kidding. Your second degree burn is a little bit deeper because I'm so sorry. The superficial part of your dermis is also affected. So your skin becomes red, painful, and may blisters ka na. Okay? Now, your third degree Your fourth degree burn usually is very bad prognosis. It's very bad na. Pero when you reach third degree burn, this is it's here. It becomes painless. So when you ever encounter a patient or anyone na sunog, no, or nalakwahan or whatever, and then they can't feel pain, that's a very bad sign. That means it's malala na. When I see patients, in my case, sa ER, for example, and they're like screaming because it's so painful, kaya they had a burn, nalakuhan init. My way of trying to comfort them is to say that you have to be happy, and I know you can't be happy when you're in pain, obviously, but it's a good sign if you're in pain because that means that the burn is not that bad. It's easily treated. So, and you're layo ka sa dehydration, layo ka sa shock, but still needs to be treated. But at least layo ka sa very big issues. So, okay, going back, your third degree, you can see here, full thickness burn na ni silang adwa because we really don't make it. We try not to get it to the point of a fourth degree burn because this is very, very bad. I've not seen a patient survive a fourth degree burn because usually when you reach a third degree burn, it's not just one part of the body that's at this level. It's usually dako ng surface area affected. So you can't just amputate easily. Kay dako na gid nga area affected. You can't just mayo kung gamay lang a part kaya okay, theoretically you can amputate. But that's not in real life. It doesn't really work like that. Sometimes they don't survive. I've seen patients like this. So, umana siya. With your third degree burns, you can skin grafts are actually applicable. We do that here in our city if resources will allow. And the area becomes blanched. At kasi ko sa inyo, nga doon nag-lapsi na siya. Hindi siya pallor, it's blanched. Okay, it's gray-white. Sometimes it's black. But sometimes when it's black, it's actually a fourth degree burn because it's really deep. It's dry and leathery. Amputation usually, but I've never seen a fourth degree burn because if they do have fourth degree burns, usually they're dead. Okay, so munition, no. As I said, first degree burn, a sunburn. This is your second degree burn when there's blisters. This is really painful. And this is your third degree burn. As you can see, no, medyo brown black na siya. Sometimes may mga blisters pa na da because it's a combination. So you can't just say oh, we'll amputate that. But some surgeons, they do skin grafts with this. But the skin graft, more doctor stuff. The skin graft is the least of your problems. You have to stabilize your patient first. Make sure the patient doesn't go into shock. That's why you have to stop the dehydration and stop the bacteria from coming in. And then the skin graft comes next. Pero it mostly depends on the resources of the patient. So guys, try not to get burned. Wear sunscreen all the time. Okay, so let's skip this, huh? Because this is a little too deep enough for you. You tackle this when you get to medical school, but it's good to read about this, okay? But I won't focus on that on my tests. Now, let's move on to something a little bit more common. Well, not very common in our race, but it does happen. Skin cancer. It's the most common form of cancer in humans, and the most important risk factor is overexposure to ultraviolet radiation in sunlight and tanning beds. Not really much of an issue for us, although some people do have skin cancer. Filipinos do have skin cancers. But the thing with us is, we try to avoid the sun as much as possible, except for me, siguro. So wear sunscreen all the time. Start young. Okay. So we have, hey, when you say cancer, no, cancer means new growth. So if it doesn't multiply, if it just stays as it is, it's called a benign tumor. It's not necessarily a cancer, because when you say cancer, usually it's malignant, no, in layman's terms. But when it's benign, when a growth is benign, it means it does not spread. It stays as it is. And malignant, this is the highest tier cancer. That That means it has invaded into other body areas. Okay, remember our lecture on mitosis? Because the cell naturally um, multiply, di ba? We've learned about it. Now, if your cells go haywire, may nabasa ako rin, cells gone wild. Wala din. Okay. Mitosis gone wild. How much siya galing? So, if your this if this multiplication of your cells go out of hand and it multiplies at an unstoppable rate, um, because when it multiplies a little too fast, there is no room for your body to put in roadblocks, to do checks, to do quality control. So this is why cancer cells are really bad, because it has so many errors, as you can see here. No, amo ni siya. Amo siya, no? So, because tama ka dasig sa iya, sa multiplication sa cancer cells, there's no, wala checkpoint. So, damo errors during replication, DNA replication, during mitosis. So, it becomes so uncontrolled, and if you do not intervene, it can uh, spread to other parts of the body, or we call it metastasis. Okay. Now, your most common types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. These are applications na. You don't have to go in depth with this. I might get one topic from this, go for quiz. You can just read through it. Don't. If you want to aim super high, then you can master concepts like burns and cancer. If you just want to pass, you can just go through these topics. Okay, it's up to you. Okay, so your basal cell, just remember, basal cell carcinoma, just remember that this is the least malignant and the most common type of skin cancer. This is when the cells in your sac basale. Oh, sorry. Oh, no, oh no. Oh, no, 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 no. Sorry, guys. Okay. This is when the cells in your sac basale are altered so that it can no longer make energy. And usually the skin or your basal cell, the affected part of your skin has basal cell carcinoma, would appear as shiny, dome-shaped nodules. Okay, and sometimes they have central ulcers, but not all the time. See, it has a dome. It looks regular, pero it has weird colors on it. Like hindi siya even ang color, although dome-like siya, kag do medyo it's benign looking, right? But it's not, because there's actually an ABCDE of skin cancer, of a melanoma. So one of them is the distribution of color on a particular lesion. This is a lesion, guys. In general, anything weird that goes on your body is called a lesion. On your skin, it's a lesion. Okay. So this lesion, for example, hindi evenly distributed ang colors sa ini nga particular nga nodule. So, kita mo di itumbi, tapos diri it's not, tapos diri brown, tapos diri darker siya. That is one characteristic of melanoma. In this case, a basal cell carcinoma. Yeah, it doesn't follow nga all the time may ulceration sa nga. Sometimes. Now, with your squamous cell carcinoma, it's believed to be induced by UV exposure. This time, it arises from the cells of your stratum spinosum. Okay? The lesions this time sometimes appear scaly, medyo red, tapos sometimes may shallow ulcers. The earlier you remove it, the better chance of curing it. Okay? It can metastasize or it can spread to your lymph nodes if they not. So this is an example of squamous cell carcinoma. As I said, in the color, look at that. Oh, although you would think na medyo symmetrical siya, but the colors are not even. Okay? Tapos damo siya nodes. And then, hindi even ang iyo borders. The borders, you also have to consider that. Like, look at this. Diri ako, uneven diya, tapos diri do ka elevated siya, tapos diri do ka medyo flat. So, uneven ang borders niya. It's one characteristic of a melanoma as well. So, I'm siya gin-mention ko kagina ng ABCDE. So, the malignant melanoma is the most deadly of skin cancers. but it only accounts for 5%. This is the cancer of your melanocytes. Uh, this also metastasizes or sorry guys. It also spreads rapidly to your lymph and blood vessels. And we also use the ABCDE for recognizing melanomas. Basically, we use it for skin cancers, but most of the time we use the ABCDE for malignant melanoma. So this is your ABCDE: asymmetry, irregular borders, color, diameter, evolution. Please be familiar with this. Just remember, if you go to medical school, this will become a little bit more common. You probably have to memorize this. But for now, just be familiar with this, okay? This makes learning easier when you know that there's an application for what you learn. So this is the application already, huh? A, B, C, D, E, asymmetry, kambang, ang alum, hindi regular ang borders ang alum, lain-lain ang colors ang alum, kadako sang alum, it's more than 6 millimeters, kag naga-evolve siya over time, like nagadako siya, or nagalain yung tsura, nagalain yung color. So, amo na siya, that's what you mean by everything. Okay, so amo na. This is a malignant melanoma. As you can see, no? Hindi siya symmetrical, ang borders niya irregular, ito ang colors niya, no? Then itom, tapos then hindi, tapos dako-dako siya. This is most likely more than 6 millimeters. And evolution, most likely nagadako na siya. I think diri na siya nagsugod, tapos nagdako lang siya. Okay? So, let's now move on to some ano yun? Nice to know parts. Some applications of your skin topic. Now, lanugo hair or downy hair, this is the hair of the baby. Pagkatao sa bata, sometimes it has hair. It's called a lanugo. They say it disappears by birth, but it still persists for a while, and then the older the baby gets, the lanugo hair goes away. Pero that's what you call I'm not saying the baby hair, no baby hair, no tubo, ha? The hair on a baby, that's a lanugo hair, like a newly born baby. Okay. So, baby, yung bago tawo, has a vernix caseosa. It's like this wet, oily, waxy thing that covers the baby, and you're not supposed to get rid of it. You're just supposed to let it stay there on the baby, because it is their protective body lotion, inborn body lotion. This is just a nice to know thing when you get to, if ever you go to med school. I know some of you want to. You remember that the vernix caseosa, you don't remove it. You let it stay there on the baby because it's protective. Okay. So, sorry. Sometimes your babies have small white spots. We call this the milia. And they're common at birth. Yung mga gamay na, ari mo, the white head sa baby, it's milia, it's normal. It goes away. Now, we can all relate with acne. It appears mostly during adolescence and sometimes persists all throughout adulthood. So when we go older, we get more acne, sometimes scaling, sometimes dermatitis, okay? Common with aging skin. So sad. Okay. When we're younger, our skin is thicker, it's resilient, well hydrated, and it should dry. But as we get older, our skin loses elasticity and it becomes thinner. So, as we've said earlier, skin cancer is a major threat to get exposed to excessive sunlight. And balding or alopecia, graying occurs with aging. It's usually genetically determined. If you see that your dad is balding, now you're most likely going to go bald too when you get older. But other factors contribute to it, like drugs and motion stress. And